Hi guys, it's Karla and I'm here at the Cancer Treatment Centers of America in Zion with my naturopathic oncologist extraordinaire, Dr. Shelly Smekens. Did I say it right?
Yes, you said it right.
And she is going to talk to us about some things that people who have had breast cancer or cancer in general too can do to combat the effects of treatment, chemotherapy, and that sort of thing. So we're gonna check in with her. Here she is.
Hey, Karla and listeners. So I've been working with breast cancer patients for the last decade, and a lot of people focus on things like hot flashes and vaginal dryness and joint pain, and those are very real side effects of these treatments. What people kind of gloss over or don't talk a lot about is that suppressing hormones can also affect the skin and connective tissues. A lot of my patients are very frustrated with changes in their skin. They feel like they're aging faster, they're drying out. And when I'm speaking with Karla about things that are safe for her to use and that actually work, we're going to span and talk about a few things and why they potentially could be helpful and what to look for not to have as ingredients in your beauty products.
Okay. Lovely. So Dr. Shelly,
we're going to talk about some ingredients that I use topically. And in a future conversation, we'll talk about internal things that can help with collagen and moisture. But for just today, we'll focus on topical things. So the first thing I want to let everyone know about is what we do not want in the products. I do not want any parabens or any phthalates. The reason is those ingredients are put in sometimes as preservatives and sometimes to change the texture of beauty products. However, they are a class of ingredients that we will call endocrine disruptors. So they can mimic things like estrogen in the body. And for my breast cancer patients or endometrial cancer patients, it's not okay to be having excess exposure to some what we call xenoestrogens or endocrine disruptors.
So the PABA, is that what you said?
Methylparaben and phthalate.
Okay. What are PABAs?
That's another ingredient that potentially can affect signaling between cells. We don't know quite as much yet whether that has a negative impact. And I should say, really, this isn't really just about cancer. We also have looked at body burden of some of these ingredients that could potentially impact things like diabetes. And there's animal studies that suggest that, and also some population studies looking at exposure and blood levels and increased incidence of other types of conditions too.
So you said parabens, or what was the second one?
Phthalates. And it's spelled kind of funny. Okay. So it's PTH. There is a website. It's called Skin Deep. It is run by a nonprofit called the Environmental Working Group. And if you're not sure how healthy a beauty product is, you can enter it into their database and it'll let you know what it contains.
Nice.
And if there is something potentially harmful, it will tell you why.
So you can put that on the screen. So
fantastic. Nice. So make it easier for people. I even pull it out when I'm shopping and I will say, oh, like this eye cream looks fantastic. And then I'll enter it into the database and see if there's anything in there. Because you can't know all the chemicals. You can't know all the ingredients. And sometimes you'll read a chemical name for something and it's really just a naturally occurring thing. Avocado oil or something that is okay to have in our product.
Okay. So would you recommend that we do vegan products? I see this product is vegan.
For the most part, I do think about like the environmental impacts, and I prefer that a company, practice sustainable practices and, think about ethical things like testing on animals. So I don't think about it quite so much in terms of the cancer risk, but I think about it as being good stewards of the world and what that means energetically and karmically, and that matters to me too.
Awesome. So tell me about these products.
Okay. First off, I'm just going to say I don't work for any of these companies and I have no financial affiliation. So really I'm going to talk about ingredients more so than brand names. Okay?
That makes it even better that you don't have any affiliation because you really do believe in these products.
Yeah, so there's authenticity to everything that we're going to be talking about. Okay, so the first thing can be used, and it's running away. The first thing that we're going to use is a moisturizer that contains vitamin C. And this one also contains a probiotic in here. So people talk a lot about the gut microbiome. So good bugs living in your intestines. The same is true for the skin. The skin is absolutely not sterile. So what can happen sometimes when we don't have good bacteria or friendly bacteria living on our skin is you can be more prone to acne and you can create a microenvironment that might be too acidic. So that's a consideration. Vitamin C in here is really important as an anti-aging ingredient and as a protectant against environmental. And how does it smell and how does it feel?
It smells and it feels lovely.
I like the lightness of it too. So some of the moisturizing products that work well but are on the market just have, like, they're too thick. Like the viscosity of it is too thick, so they're not enjoyable to put on, and they feel heavy.
Find this on Amazon or something?
Yeah, potentially. And there also are like professional websites, Fullscript, Wellevate, that carry professional level supplements and natural products. I'm a big person in worrying about where our products come from, because I just don't want counterfeiting. So or I don't want something that's been sitting in a warehouse at 140 degrees, and then you can decrease efficacy. Totally broken down. Totally broken down. These things aren't completely stable.
Because I don't really do much facial care. I know everyone says, "Oh, your skin's so nice." I really do barely anything, but I really want to start doing, because of the dryness, and I'm over 40 now. I feel like I want to go to bed.
Doesn't look over 40 though.
I want to go to bed, and I need to like have a regimen and things. And this is nice. I can wear this in the daytime.
Yes.
Does it have a sunblock?
I do not believe that one has the SPF in there, and this could be a whole nother conversation, but of course I prefer mineral sunblocks, because again, we don't have the chemical exposure. We could talk about it for a whole nother half hour.
That's good to know. We can do that. Because as a black woman, I don't know a lot about SPF. I mean, I know I need to look for it, but I don't know all the ins and outs.
Next conversation. We'll definitely talk about that.
Okay, so this one.
Okay, so next one is a coconut oil-based product.
You can get this at like Target.
This is really inexpensive, super easy to find. You can tell I use it a lot because I'm missing the pump on it.
Do like the YouTubers do.
Yes, exactly. So I use this on hair ends. So a lot of times people have hair changes on the breast cancer treatments. They have more breakage, they have less hair growth, they're more heat sensitive, so be careful about using blow dryers and flat irons.
I left my hair stuff today. On this trip, and obviously forgot my lipstick too. I'm like, why do I look so drab?
Karla always looks beautiful. I don't know what she's talking about. These are just like extra things on top for her. She always looks stunning.
Thank you.
So this I will have patients put on the ends of their hair before they use any heating products or any styling. It's about dryness, it's about integrity, and it's about anti-breaking, and of course, using something natural is important to me. So I'd rather use oils that are naturally occurring. Okay. So lastly, I put a hyaluronic acid serum. So right now,
paraben free.
Yes.
Like she said, don't get into the parabens. Can you see? Ooh. Okay.
And this is not expensive either. So that's the issue for me with a lot of the hyaluronic acid products.
Firming serum.
They're super expensive. Like, who wants to shell out $200 for a serum?
Girl,
particularly
so cheap.
Yeah.
It's so cheap.
Particularly as you look at percentage increase where we actually get a therapeutic effect. Hyaluronic acid looks to reduce fine lines and wrinkles. There's research supporting that is effective. It's available in an injection. It's available topically. This, a lot of times, I'll have people put on before a moisturizer, or I'll have them put it on in the evening before they do a type of night cream. So hyaluronic acid is available in a more affordable way, and this is all about moisture and kind of plumping, right? Which is, as we age, we tend to have less of that. We tend to have...
put this around my smile lines. I've had them since I was a child, but now...
But at least they're smile lines and not frowning lines, so I'm happy about that. Karla always brings sunshine. I look forward to seeing her. And next time we will talk about internal use of nutrients as anti-aging.
We need to talk CBD.
We should also
talk
CBD.
Everybody, everywhere. In Texas even now, I'm seeing CBD pop up. And people are like, buy my new CBD product. And everybody's selling a CBD.
Yes, and let's talk about fact
do I need to get on the train?
Right. There's so many ways to use CBD too. You can use it internally, you can use it topically, you can use it rectally, you can use it vaginally.
Pain and everything.
So we should have a long conversation about that as well.
We absolutely should. I think we're going to keep doing this.
Karla.
It's going to be great. Thank you, Shelly. What about the external? What is that? Internal stuff.
That's coming. So next time we'll talk about all things internal as beauty agents that are safe to use in the cancer population.
Yes, because you helped me a lot with my protein powder.
Yes.
And I was talking to someone about that. They were saying, what about soy? Soy bad for you, blah, blah. I said, I don't know. I just know that my Dr. Shelly told me which protein powder to get because there's some issues with the protein, soy, and the... And other than that,
so we'll have a conversation about proteins. Just the short is, I'm good with soy foods, but not soy protein isolate, which is found in soy protein powders, which if you look at a lot of like frozen meals or things that are vegan, it's all soy protein isolate. Nutritional value is just not there. You may as well eat the box it comes in. But that's, again, another conversation. We will talk.
Good to know. Thanks, Dr. Shelly.
Yay.
Love you,
Another
girl.
huggy.
Okay, see y'all. Hope this helps. Bye.